Audio Jungle. Audio Jungle. Audio Jungle.
Sajid Javid will address NHS demands for a COVID plan C in a Downing Street press conference tonight after Tory MPs today slammed health leaders for urging ministers to immediately reimpose face masks and work from home guidance. The Health Secretary will lead No 10's first COVID briefing in a month at 5 de la tarde, with infections having soared to their highest level for almost 3 months and growing concerns about the country's sluggish booster hub rollout. NHS chiefs want ministers to bring out tough backup restrictions, which include vaccine passports in nightclubs, and start forming a last resort plan in case the measures fail to curb pressure on hospitals over the coming weeks and months. Coronavirus deaths in the UK yesterday rose to their highest daily level since early March. Experts fear the growing outbreak may have been exacerbated by an even more infectious offshoot of Delta called I.4.2. The proportion of cases made up by the sub-strain have doubled in a month, official figures show. Backbenchers today hit back at the NHS demands, claiming that turning on freedoms could result in an endless cycle of lockdowns every year. Health and Social Care Committee member Paul Bristow slammed NHS bosses for trying to bounce government into restrictions. Steve Baker said, "We cannot allow the liberties of the people of this country to be a tool of NHS capacity management." The government rejected the NHS pleas, with Kwasi Kwarteng ruling out any lockdown. He claimed the return to normal life was a very hard one and insisted that Britain's approach is working. The business secretary added the government does not feel it's the time for Plan B right now, H1 No 10's official stance yesterday. Mr. Kwarteng said he would continue to urge people to wear face masks in public and considered the slow uptake of coronavirus booster hubs is something we really need to address. Less than a third of care home residents have received their third dose, according to official data. No 10 is demanding better results on booster take-up, with ministers launching an UTB campaign to encourage people to book appointments when they are invited. Tonight will be the first COVID press conference, which were a mainstay when ministers announced restrictions on freedoms during the height of the pandemic, since September 14, highlighting the escalating fears about the winter crisis. Last month's presser was attended by Boris Johnson, Professor Chris Whitty and Sir Patrick Vallance, when they discussed vaccinating overdoses, the booster program and the government's winter plan B. It comes after emergency COVID powers used to impose a house arrest, close businesses and schools, and restrict gatherings were extended for another 6 months yesterday. The rapid spread of a more infectious Delta variant was laid bare today by a series of maps revealing how it surged across the whole of England. One of the government's major COVID tracking projects first spotted the subtype WFH in June, with 19 cases scattered across London and the southeast. But within a week, the number of infections had doubled to 47, and the variant was advancing into areas of the Midlands, east of England and the southwest. In just over 3 months it had reached almost every part of England. More than 2,500 cases of the subtype were detected across the country last week, meaning it now makes up almost 10% of all infections. The hotspot is in Adur, West Sussex. Scientists say the strain, thought to be 10 a 15% more transmissible than its ancestor, likely first emerged in the UK because of the high number of infections here compared to other countries, which gives the virus more chance to mutate. A separate dataset tracking variants globally puts its first emergence in Britain at June 14, followed by Ireland in late June, Germany in July, and Denmark and the USA in August. There is no evidence that it makes vaccines less effective or is more likely to trigger hospitalization and death, but no 10 has but to keep a close eye on I.4.2. There have been some 20,248 cases of I.4.2 in the UK to date, data suggests, and 13 in the USA. Experts believe that the World Health Organization will elevate the subtype to a variant under investigation in the coming days. It is likely to be named Nu, the next letter in the Greek alphabet. In other coronavirus developments today, Mr. Bristow said reintroducing restrictions now would set a precedent for having lockdowns every year. He said, "The NHS Confederation are wrong to try to bounce the government into restrictions. Case rates driven by school return but fewer COVID hospitalizations than last month. This will only scare away those needing NHS treatment." If we lock down now due to winter NHS pressure, it will happen every year. And Steve Baker, deputy chair of the COVID recovery group, said the course of society cannot be based purely on managing NHS capacity. Et al. Talk Radio. Think if we cross that Rubicon we end up prioritizing healthcare above everything else. Of course, healthcare is super important, it's extremely important to everybody in my constituency. But we really have to ask fundamental questions about how we're choosing to live. And what I would say is, yeah, okay, if we do have to take some measures, let's do it on a voluntary basis, but let's not be shutting down businesses. There is a wide range of damage that comes from lockdowns and restrictions, and we can't afford to keep propping up businesses. Mer Quarten dismissed early calls for Plan B, telling BBC Breakfast the return to normal life had been a very hard one. He said, what we have to remember in all this is that the vaccination rollout has allowed us to get some kind of normality. We've had our lockdowns, we've managed to reopen the economy successfully, we've managed to get back to normal life, and those gains were very hard won. And I don't want to reverse back to a situation where we have lockdowns. I don't think it's necessary. We think the course that we're plotting is the right one. Just over a quarter of care home residents have had a COVID booster vaccine. Data shows amid fears that millions of elderly Britons will be left vulnerable to the virus this winter. NHS England data shows that just 27.8% of care home residents have received their crucial third dose, and only 14.1% of STAFF have been boosted. That's despite the booster rollout launching over a month ago and care home residents and their carers being highlighted as the top priority groups. The data also shows that little over half of eligible people over the age of 80 in England have been given a booster, while just a third of 75 to 79-year-olds have been revaccinated. Pressure is mounting on the government to get the sluggish program up to speed as daily infections approach peak second wave levels and the NHS gears up for a harsh winter. Members of No Zero's own scientists have publicly called for ministers to hurry up with the program, which prompted Business Secretary Kwasi Kwarteng to admit today it was something that we really need to address. NHS England boss Amanda Pritchard yesterday claiming the elderly are not coming forward quickly enough for their boosters. But sources close to the booster drive told Mail Online capacity is also an issue, with figures showing there are nearly a third fewer mass vaccination hubs in operation now compared to April, when more than 400,000 extra hubs a day were being dished out. An NHS practice manager said GPs are prioritizing clearing the record-breaking backlog of 5.7 million patients waiting for routine treatment in the UK over dishing out hubs. But Matthew Taylor, chief executive of NHS Confederation, an organization that represents NHS trusts, warned the health service is preparing for the most challenging winter on record and risks stumbling into a crisis without urgent action to stem the growing outbreak. He said the consequence of not acting now would be the NHS struggling to tackle the record-breaking backlog of 5.7 million patients waiting for routine surgery. Hospital bosses already fear the waiting list will not be cleared for at least 5 years. Mr. Taylor told The Guardian, "We're right on the edge, and it is the middle of October. It would require an incredible amount of luck for us not to find ourselves in the midst of a profound crisis over the next 3 months. The government ought to not just announce that we're moving to Plan B, but it should be Plan B+. We should do what's in Plan B in terms of masks, and working from home, but also we should try to achieve the kind of national mobilization that we achieved in the first and second waves, where the public went out of their way to support and help the health service." In a second interview with BBC Radio 4 Yesterday program, Mr. Taylor said the NHS was facing a perfect storm. Think the government needs to look at all those measures which science tells us can reduce the spread of the virus and further down the line the number of people going into hospital and dying, he said. The winter is always tight for the NHS for a number of reasons. You add in COVID patients, then you add in pent-up demand of people on waiting lists and those who haven't gone to the doctor and are now presenting with quite challenging symptoms. Speak to health service leaders every day and they have literally not spoken to any leader who doesn't say their service is under intense pressure now. We are in October and it is only going to get worse. Added, the risk of the NHS being overwhelmed is there. At the moment the system is working flat out and those winter pressures are going to grow. One of the consequences of not taking action is it will be very difficult to make any progress at all for those people who have been waiting a very long time for treatment. On Tuesday, the government said a further 223 people had died within 28 days of testing positive for COVID, bringing the UK total to 138,852, while the numbers are often higher on Tuesdays because of a lag in reporting deaths and cases over the weekend. This is the highest figure for daily reported deaths since March 9. Meanwhile, the 7-day average for cases is standing at 44,145 cases per day, the highest level for almost 3 months. Mr. Taylor urged the public to show extra support for the ends by behaving in ways that will keep themselves and others safe. He added, "It is time for the government to enact a plan B of its strategy without delay because without preemptive action, we risk stumbling into a winter crisis." Also, health leaders need to understand what a plan C would entail if these measures are insufficient. The government should not wait for COVID infections to rocket and for NHS pressures to be sky high before the panic alarm is sounded. Mer Kwarteng also told Sky News the vaccine rollout had been the most successful thing we've done and urged those eligible to take up the offer of a third dose of the vaccine. The business secretary said, "The critical thing, as my colleague the health secretary has said, is about hospitalization and also deaths, and, thank God, those figures are much lower than they were, certainly, at the beginning of the year." Said the government was concerned about rising deaths, but added, "You'll remember at the beginning of the year we had hundreds, if not thousands, a day. Mercifully that hasn't happened and, as the health secretary said, it's something we're going to have to live with and I think we are managing the situation." Mer Kwarteng said, "The infection rate was always likely to go up as we opened up the economy, because as people get back to normal life, the infection rate was likely to go up. But what was critically important was the hospitalization rate and the death rate as well." He insisted the government was not waiting and watching as those figures rose. He said, "We're simply trying to analyze the data as we see it and come up with the right policies. Now, that's something which could change but, at the moment, we think that the course that we're plotting is the right one." Mer Kwarteng was also asked whether he would encourage people to wear face masks routinely. He told BBC Breakfast, "Wear face masks in public places, particularly on public transport, and people generally, as he noticed on the tube in London, tend to. They do wear face masks and face masks are worn. So, that's something which I think is a good thing. Think people should do what they feel is the right thing to do. The wife got to, I think, be respectful towards other people, the wife got to keep themselves safe and the public as well. The UK's top scientific advisors have only met twice in the last 3 months. It was revealed today amid fears a fourth COVID wave is just around the corner. SAGE, which has guided the government through the COVID pandemic, last met on October 15. The October meeting was the second in as many months, with the influential panel last coming together before that on September 9. The group, which includes England's Chief Medical Officer Professor Chris Whitty, Government Chief Scientific Advisor, Sir Patrick Vallance, and Professor Lockdown Neil Ferguson, among others, didn't meet in August at all. Labour today claimed it beggars belief as to why SAGE was effectively stood down, with cases having soared to a 3-month high of around 45,000. There were 223 recorded deaths from the virus in the UK yesterday, the highest total since March, a month in which SAGE met 3 times alone. It is understood that both Professor Whitty and Sir Patrick have raised alarm about the figures in recent days and that internal discussions in government have turned to possibly reimposing some of the milder lockdown measures this winter. Though Downing Street is reportedly resistant to this. There are also concerns about the rise of a new Delta variant of the virus in the UK. The variant called I4.2 could be up to 10 to 15% more infectious than its ancestor. This, combined with a slow rollout of the COVID booster program, with nearly 5 million vulnerable adults yet to receive theirs, indicates there may be some dire weeks to come in Britain's fight against COVID. SAGE meetings have diminished in frequency since February, when the second wave was just starting to fizzle out. Since then the group has mostly met thrice or twice a month, but August this year was the first time the group did not meet at all since the pandemic began. In comparison, SAGE met 4 times in August 2020, 6 times in September 2020, and 5 times in October last year as the country headed into the colder months and the onset of the second wave of the virus. It contains some of the UK's leading epidemiologists, virologists and other health experts, with meetings also regularly attended by government officials. At meetings they analyze the latest trends of how COVID has been spreading in the UK, and the latest research into the virus and how it can be contained and treated. The Prime Minister's official spokesman as previously said Plan B would only be used if there was a significant risk of the NHS being overwhelmed. The spokesman said, there are a number of different factors that would play into that decision. Largely it would be required when there was a significant risk of the NHS being overwhelmed. We are not at that point. Because of the vaccination program, the levels we are seeing in both patients admitted to hospital and deaths are far lower than we saw in previous peaks. On Tuesday, Professor Neil Ferguson, a leading member of the Scientific Advisory Group for Emergencies, SAGE, said he thinks Plan B could be implemented in England this winter, but it is unlikely we'll ever get closer to the lockdown the country experienced in January. He added that the UK is no longer in the top rank of European countries in terms of overall vaccination coverage, particularly in vaccinating teenagers. The UK now has one of the highest weekly rates of new reported cases in the world. Just over 67% of the UK population has received 2 doses of vaccine, according to government figures, compared with at least 75% in Denmark, 79% in Spain and 86% in Portugal. The weekly rate of new reported cases of COVID-19 in the UK has jumped from 367 cases per 100,000 people at the start of October to its current level of 463 per 100,000. By contrast, rates have dropped to very low levels in neighboring countries such as Spain, 24 per 100,000, France, 48, and Germany, 80. SAGE fears there will be a fourth wave by the end of the year that may cripple the NHS. Ministers are overseeing a rollout of booster jabs to over 50s, healthcare workers and the immunosuppressed to protect the health service as much as possible and prevent NHS having to reintroduce masks and WFH guidance as part of its Plan B. But experts have warned the top-up jabs are being dished out too slowly, with 5.7 million vulnerable adults eligible for a third dose yet to receive one. Influential government advisor Professor Ferguson, an epidemiologist at Imperial College London, insisted it was critical we accelerate the booster drive to give ourselves the best chance of avoiding having to bring back Curve S. Meanwhile, Health Secretary Sajid Javid warned there is huge pressure on the NHS in England. The increase in cases has been in part blamed on the new variant, which academics estimate may be up to 15% more transmissible than the original Delta, which rapidly became dominant in Britain in the spring before taking off worldwide. It has been detected in almost every part of the country, figures show, and it's thought to be behind almost 60% of positive test samples sequenced in Adur, West Sussex. NHS yesterday said it was keeping a very close eye on it. 4.2 but insisted there is no evidence that it spreads easier. Boris Johnson's official spokesperson also warned the government won't hesitate to take action if necessary. Experts suggested the uptick of I.4.2, one of 45 sublineages of Delta, may be partly to blame, along with the return of pupils to classrooms from August and workers to office. Professor Franco Isvalu, director of the University College London Genetics Institute, told the Financial Times the strain could be the most infectious subvariant since the pandemic began. But he noted Britain is the only country where the sublineage has taken off, so its quick growth could be a chance demographic event. The World Health Organization will likely elevate I.4.2 to a variant under investigation, which means it would be given a name under its Greek letter naming system, Professor Balu added. Kwasi Kwarteng has ruled out a winter lockdown despite concerns around the slow booster COVID vaccine rollout. The business secretary said NHS is concerned about the slow uptake of third jabs in light of rising COVID cases. Bote said that ministers don't want to go back into further restrictions and noted there were no vaccines this time last year. Mr. Kwarteng told Sky News, "Think the conversation about restrictions on travel, restrictions on more lockdowns is completely unhelpful. The vaccine has changed our total approach to this and has given us a measure of security that is very important. He would rule lockdowns out. As the health secretary said, it's something we're going to have to live with and I think we are managing the situation." A total of 43,738 positive tests were recorded yesterday, a 16% week-on-week increase. A further 223 deaths were registered, the highest single-day reported figure since March. He said, "The emergence of yet another more transmissible strain would be suboptimal. Though, this is not a situation comparable to the emergence of Alpha and Delta that were far more transmissible, 50% or more, than any strain in circulation at the time. Here we are dealing with a potential small increase in transmissibility that would not have a comparable impact on the pandemic." The UK Health Security Agency, which took over from the now defunct PHE, revealed in a report on Friday that the subvariant is expanding in England. It includes two mutations, called Y145H and A222V, and is being monitored, the UKHSA said. Both of these spike mutations have been found in other virus lineages since the pandemic began, but are not present on any current variant of concern. Professor Balu said the mutations are not obviously linked with increased transmissibility or evading protection granted by vaccines. Only 4.2 cases have been spotted in the US, while 2% of cases in Denmark are caused by the sub-lineage, he added. Data from the Sanger Institute suggests the sub-lineage is most prevalent in Adur, where 61% of all positive samples sequenced were linked with I.4.2. The subvariant also seems to be highly prevalent in East Lindsey, 46%, and Torridge, 41%. It comes as the UK recorded 49,156 new COVID infections yesterday, marking another 3-month high. Hospitalizations and deaths are also on the rise. Some experts have said the subvariant may be behind the surge, which other European countries are not seeing to the same extent. Former US Food and Drug Administration Commissioner Scott Gottlieb tweeted on Sunday, "We need urgent research to figure out if this Delta Plus is more transmissible, as partial immune evasion. How much more infectious is I.4.2? Experts estimate the newly emerged I.4.2 subvariant is 10 to 15% more transmissible than its ancestor. Its prevalence in England doubled in a month from being behind 4% of cases in September to 8.9% in the 2 weeks to October 9, but experts will need to keep monitoring the sub-lineage to determine if it really is more infectious. Is I.4.2 more deadly than earlier versions of Delta? There is no evidence I.4.2 is more deadly than earlier versions of the Delta strain, which was first identified in India last December. Deaths in England have been relatively flat for months. Due to the time it takes for someone to catch the virus and become seriously unwell, any impact the subvariant has on deaths will likely not be clear for weeks. Whereas I.4.2 been spotted, the subvariant has been spotted in nearly every part of England. Data from the Sanger Institute, which sequences thousands of COVID samples in England every week, suggests the sublineage is most prevalent in Adur, where 61% of all positive samples sequenced were linked with I.4.2. The subvariant also seems to be highly prevalent in East Lindsey, 46%, and Torridge, 41%. Is it behind the surge in cases? Some experts have said the subvariant may be behind the surge in cases in the UK, which other European countries are not seeing to the same extent. But Dr. Jeffrey Barrett, director of the COVID Genomics Initiative at the Sanger Institute, said I.4.2 alone does not explain the UK's caseload, which is instead linked to the UK imposing less restrictions than other countries. And as I.4.2 is still at fairly low frequency, a 10% increase its transmissibility would have only triggered a small number of extra cases. Official figures have shown cases are also being fueled by youngsters returning to classrooms last month, with as many as 1 in 12 being infected. But Dr. Jeffrey Barrett, director of the COVID Genomics Initiative at the Sanger Institute, told the Financial Times I.4.2 alone does not explain the UK's caseload, which is instead linked to the UK imposing less restrictions than other countries. Professor Balu said its rapid spread could have caused a small number of additional cases, but added, it hasn't been driving the recent increase in case numbers in the UK. Official figures have shown cases are also being fueled by youngsters returning to classrooms last month, with as many as 1 in 12 being infected. The Prime Minister's official spokesman said the government is keeping a very close eye on the subvariant. They said, there is no evidence to suggest that this variant, the I.4.2 is more easily spread. There is no evidence for that, but as you would expect, we're monitoring it closely and won't hesitate to take action if necessary. Dr. Alexander Edwards, an immunologist at the University of Reading, told Mail Online it would be concerning if a variant starts to dominate that evades vaccine immunity. He said, before the successful rollout of vaccines, this was less likely to happen, but now, with such a high proportion of the population infected, alongside waning immunity, now is the time to be extra vigilant. Luckily, we can redesign our vaccines very quickly now, so there isn't yet anything to be afraid of. But any efforts made now to reduce cases and improve immunity, through boosters, vaccinating younger people, testing and effective isolating, could pay off if they cut the risk of vaccine-evading variants. Professor Lawrence Young, a virologist at the University of Warwick, told Mail Online the detection of I.4.2 highlights the need for continued genomic surveillance of the virus. Experts will need to monitor it to determine if it really is more transmissible and if it has any impact of the efficacy of vaccination, said. Professor Young added, the continued spread of the virus at a high level in the UK increases the risk of variants being generated that could be more infectious and more able to evade vaccine-induced immunity. It comes as official figures show nearly 5 million vulnerable adults have yet to receive a COVID booster vaccine, after Downing Street admitted Britain faces a challenging winter. Despite the NHS top-up program launching over a month ago, only around 3.7 million out of the 8.5 metros eligible people in England have received the crucial third dose. No 10S scientists approved plans to revaccinate all healthy over 50S, frontline health staff and carers and patients with underlying medical conditions 6 months after their second dose, after evidence showed it was the sweet spot for immunity. The lagging rollout has left around 4.8 metros people with suboptimal immunity as the country moves into the colder months and faces the double threat of increasing case numbers and flu. SAGE advisor Professor Lockdown Neil Ferguson, an epidemiologist at Imperial College London, yesterday insisted it was critical we accelerate the booster drive to give ourselves the best chance of avoiding having to bring back Curve S. And Sir David King, who was the government's chief scientific advisor from 2000 to 2007, criticized the rollout for moving extremely slowly. Amanda Pritchard, chief executive of the NHS, insisted the health service has plenty of capacity to vaccinate all eligible people immediately but said people are not coming forward quickly enough. She told MPs on the health committee, it's really important that we now absolutely do get the message out that COVID is still with us. But some experts also say the booster program is going slower because the UK is juggling administering first jabs to children in secondary schools and running the largest flu vaccination program in history. Pictures yesterday show clinics lying virtually empty, some of which are not open for booster jab walk-ins, further highlighting the complexity of Britain's current rollout. It comes against the backdrop of rising cases with 49,156 infections recorded yesterday, the highest daily figure in 3 months. Downing Street warned that Britons should prepare for a challenging few months. Boris Johnson's spokesman said there were currently no plans to reintroduce Plan B restrictions, which include face masks and working from home guidance, but that ministers were keeping a very close watch on the latest statistics. Britain led the world in the initial vaccine rollout, but it has now slumped behind Italy, Spain and France in terms of the percentage of the population to be double jabbed. This is because it delayed rolling out jabs to healthy children, whereas most EU members approved those plans much quicker. All over 50S and the clinically vulnerable can get a booster jab from 6 months after their second dose. But experts have warned that at the current rate the most vulnerable will not all receive their third vaccination until the end of January. Asked if COVID booster jabs are the answer to waning immunity, Professor Ferguson told BBC Radio 4's Today program, absolutely, and there is data coming through now, which is not completely clear-cut, but good data coming through from Israel, which shows that, if you've had the third booster dose of the vaccine, then you get very high loads, better than even you had after the second dose. And so I do think it's critical we accelerate the booster program. The other thing is infection rates are highest in teenagers at the moment and most other European countries are ahead of us in vaccinating teenagers and giving them 2 doses, not just 1 dose. 2 doses really are needed to block infection and prevent transmission, so I think that's the other problem. Keep pushing on, getting coverage rates up higher in the teenagers who are driving a lot of this infection. Also called for face coverings to be brought back to remind people to be cautious in everyday interactions and remind people we're not completely out of the woods yet. All legal COVID restrictions were lifted in England on Freedom Day in July, bringing an end to mandatory coverings indoors. However, people are still required by some transport companies and in medical settings, and NHS still advises people wear them in crowded environments. Ministers are keeping masks, WFH guidance and controversial vaccine passports in their back pocket as part of the government's Plan B, if unexpected surge in cases this winter heaps unsustainable pressure on the NHS. Professor Ferguson, an epidemiologist who sits on SAGE, admitted some measures have to be rolled back, in the event of an uptick in infections. But speaking to BBC Radio 4's Today program, he ruled out another blanket shutdown. He said, doubt we'll ever get close to the lockdown we were in January of this year. Comillas sencillas.